So very good afternoon to you. First of all, before we start with anything, I would like to know your name and where have you been practicing?
Yes, I'm Dr. Lomesh Kapadnis and I'm a urologist from Nasik.
All right. So we're gonna be starting the topic on BPH. I have few questions for you. So first of all, the question is, why, according to you, are the cases of BPH on rise?
Mainly cases of BPH are rising or they are getting detected. That is the problem because earlier on in previous years, when technology was not that advanced, sonography and even urologists were not that available easily. In that time, they were maybe misdiagnosed or undetected. So nowadays, and patients are also getting aware of these problems. So that's why they are coming forward. And with the advent of sonography, easy availability of sonographies, urologists, so it is diagnosed more accurately and more at early ages.
Okay, heading towards the next question. What are the complications that could develop if BPH is not diagnosed early?
Okay. So BPH, if BPH is undiagnosed or not diagnosed early, then as the size increases, then recurrent infection, then recurrent bleeding, and stone formation. These are the earlier complications. And if later on it is still undiagnosed, then it can lead to upper tract hydronephrosis, upper tract changes, and that can even damage the kidneys.
Oh my God, that is something very huge. Okay, heading towards the next question. When does surgical intervention become necessary?
Yes, whichever complications I have mentioned earlier, so if any one of them is present, then that is also one indication of surgery. And when patient is not happy on alpha blockers, which is the mainstay for the treatment of BPH, so in those cases, or patient even on alpha blocker, he is having any of the worsening symptoms or any complication or acute urinary retention. So in those cases, surgery becomes necessary.
Okay, lastly, would you like to tell something for the viewing audience?
Yes, means the main symptoms for BPH are like increased frequency, nighttime frequency. If you have to go for to pee within 2 hours and you don't have any control on your urine, and there is poor flow. So after the age of 50 or 60, if you have any of these symptoms, you should come forward and get yourself checked from your urologist. Yes, that's it.
Okay, yes, thank you very much for your time. Have a great tour ahead. And yes, that's all.